Ministry of Health has officially launched the long-awaited lenacapavir, a twice-yearly injectable HIV prevention drug, discussed and described as a bold step forward to an HIV-free generation. So the launch presided over by the Minister of Health, this is Dr. Jane Ruth Acheng, at Lira Regional Referral Hospital, marks a significant explosion in HIV prevention options, especially for individuals at high risks of HIV acquisition, including the discontent couples. And also, government says rollout of this injectable drug will happen in phases, with 103 health facilities already trained to begin phase 1 implementation this April, and up to 3,000 facilities expected to offer this drug, lenacapavir, before December. Also, international partners, including the Global Fund, which have contributed $1.2 million towards the access, and the United States government have welcomed the innovation, describing it as a game-changing tool in reducing new HIV injections. Also, officials, however, stressed that while lenacapavir is a major significant advancement, it complements, not replacing, existing prevention methods such as condom use and broader comprehensive HIV prevention strategies. The Ministry of Health has also launched a policy framework to guide safe and equitable use of the drug, with the leaders saying that the goal is to ensure scientific innovation reaches the communities that need it the most. This happened on the 17th of April 2026. And moving forward into our next story, Uganda revives national health insurance plan as donor funding strikes. And now to a big development shaping Uganda's health future. The government is back and on a drawing board for the long-awaited national health insurance scheme. And this time, the push is stronger than ever. President Yoweri Museveni has directed key ministries to urgently redesign and fast-track the scheme, as Uganda feels the pressure of the shrinking donor support and rising hospital bills hitting the ordinary families. Simply put, many Ugandans are still paying too much out of pocket when they fall sick, and expert warns this is pushing some households deeper into poverty. Now, officials say that the new insurance model will be homegrown and contributory, meaning Ugandans themselves contribute to a system meant to protect from catastrophic medical costs. But while this sounds promising, experts are also urging caution, saying health insurance is not an overnight solution and that Uganda must still strengthen prevention, improve health services, and increase health funding right now. So the big question remains, is this a breakthrough Uganda has been waiting for in the health financing, or just another long journey ahead? And this happened on the 18th of April 2026. So in other news, WHO, which is the World Health Organization, marks 15 years of global pandemic preparedness framework, highlighting a stronger equity in the future outbreak response. And as the WHO is celebrating the 50 years of its pandemic influenza preparatory framework, a global system has been designed to make sure that the world is better prepared and more fairly protected when the next pandemic strikes. The WHO says this framework has helped countries work together more smoothly by sharing influenza virus data quickly and ensuring that when the pandemic threats emerge, benefits like vaccines and antivirus and diagnostic tools are shared more fairly, especially with countries that often struggle to access them in time. Over the past 15 years, the system has encouraged and supported 86 countries across all the WHO or World Health Organization regions, helping strengthening laboratories, disease surveillance, emergency communication, and even community awareness programs. Health experts say the big message is simple. Pandemics don't respect borders or also preparation either. And now the World Health Organization is calling this framework a real-life example of how global teamwork can actually save lives when it matters the most. And this also happened on the 17th of April this very month, 2026. And in other news, South Sudan health system is on a brink as war depends on humanitarian crisis. And now, a major international health aid emergency, Sudan is facing what the World Health Organization describes as the world's largest humanitarian and health crisis after 3 years of war. It has been ongoing. In Sudan, millions of people are struggling to access basic healthcare services as hospitals collapse and also diseases spread rapidly and malnutrition rises sharply. The World Health Organization warns that more than 34 million people are now in need of the urgent aid, while over 20 million of the people are without proper health services. Health workers say repeated attacks on medical facilities, shortages of medicines, and displacement of communities have left the health system severely weakened, and meanwhile, the breakouts of the diseases such as cholera, malaria, measles, and diphtheria are spreading across the several states of South Sudan. Despite all the ongoing humanitarian efforts, World Health Organization stresses that without safe access, stronger funding, and lasting peace, the crisis will continue to deepen, with millions of lives at risk. And in our last news, WHO also launched World Malaria Day, which is going to happen very soon on the 25th of April, as a global fight against malaria gains momentum. And the World Health Organization has launched it under the theme driven to end malaria. Now we can, now we must, with a renewed call for the urgent action of accelerate progress towards a malaria-free future. The campaign comes at the time when global health experts say that science is advancing faster than ever, raising real hope that ending malaria within a lifetime is increasingly possible. WHO says 37 countries reported fewer than 1,000 malaria cases in 2024, while 47 countries have now been certified malaria-free, a milestone being highlighted as evidence that progress can be achieved. The organization also says 25 countries are now rolling out malaria vaccines expected to protect around 10 million people each year and children, while the next generation mosquito nets are now counted for 84% of all newly distributed nets globally. New tools including long-lasting injectables, improved treatments, and also pioneering technologies such as genetically modified mosquitoes and are also being developed to strengthen malaria control. But despite this progress, WHO warns the fight is over for malaria, and malaria has also claimed 610,000 lives in 2024, a slight increase from the previous year. That a major gap is prevention, treatment, and funding. Through this year's campaign, WHO and its partners are now using World Malaria Day as a day for rallying call to protect lives, increase investment, and also push harder towards the ending of the world deadliest diseases. Let's hear that video coming in from the head.
Dear colleagues and friends, 25 years ago, world leaders made a remarkable commitment to the fight against malaria, one of the world's biggest killers. Since